Good afternoon, teacher.
Good afternoon, Salome. How are you?
Fine, teacher, and you?
Fine, thank you. And thank you for coming before.
Don't worry, teacher. Please help me some time that I need, so we are for there.
Okay, thank you very much. So let's talk about yesterday's unit. Maybe you can choose a condition, anyone that you want.
Could be cancer.
Okay, okay, it's okay. And I will make you some questions.
Okay.
And I want you to answer like you are talking about this disease, okay?
Sure.
Um, Maybe first you can explain to me what I have to do, and then I will ask questions when you told me.
Yeah. For this disease, you need to know that cancer is a pathology that now don't have cure, but exists some ways to treatment this. So the most common is the chemotherapy and radiotherapy. That is depend the kind of the cancer and how to advance it is. It's it. So maybe the doctor will do extra exams that we need to know for know which treatment we have to do. And
Okay.
after that, we need have conditions for the treatment that you have to care about yourself to be exposed to places that have a lot of virus or maybe contamination, because when you the persons, no, the people that used to make radiotherapy or chemotherapy starting to load the defense, the immunologic systems start to low as
Mhm.
as fastly as you start the treatment.
Okay, then I will ask you some questions about this. Maybe, I don't know, but do you think the treatment will work on me?
The most kind of cancer that we don't know yet about your stadio of cancer, but I think yes, because the treatment, the chemotherapy or radiotherapy could function in your. The only thing that we have to wait is about how many times we need to do this treatment,
Mhm.
but this treatment will be functioning in 18%. 18%. We cannot say 100 because any treatment have to do a 100%. With the time, this treatment arrive the 100%.
Okay, thank you. And how serious is my condition?
Actually, it's not serious, or it's serious, but not too much because you don't have metastasis in your body, and that is a good condition now. So we are on time to stop it and the dissemination. So for that reason, is we need to make a treatment, and after that we need to care about the food or nutrition that will be changed drastic, but it's for care your health.
Okay. And then how will affect my job and maybe I don't know in my home?
Okay. As I said, your immunologic system will load. So for that kind, you need to use a mask like COVID, but other mask, because you cannot receive the virus of the germs that be in the air or in the places that you go,
Mhm.
because that is damage for your body. In your house, it will be all normal, but your hygienic condition will be must to be better. And about the you clean your room and all your house, because we need to avoid all kind of, how do you say polvo, teacher?
Powder.
Powder and in the different areas of our home.
Okay. And what caused this disease or
Can I ask you something? Do you have a medical secure?
no.
No. So that's suppose that we are in a public hospital. So this treatment is free, but before start chemotherapy each session, we need to
Mhm.
administer you some medication that help us to avoid the nauseas, the vomit, and the headache. So that
Okay.
medication have to buy you by yourself, but all the other things are free for the hospital.
Okay. And maybe I don't know, but what was the cause of this disease?
Um, I know that chemotherapy each sessions. Okay, let me one moment.
Hmm?
Yeah, my mom says
Mhm.
because she's here. I will look you. Say hi, mommy.
Hello. Hello, lady.
Okay, I don't know really how much it is, but it's really expensive. I think all the treatment could be around the $15,000.
Wow. Okay. Thank you very much. And when will I know the test results? I don't know if you're gonna give me now or later.
No, this test that because I know that the doctors did you a lumbar puncture, have to wait 4 days for the results.
Okay.
So in this day, you will be here at the hospital with hydration, eating normally, and receive medication for your pain, cause of cancer, and after we make a decision. We need to talk with your family too, because in this treatment we need that the family have a have a good acceptation and be agree with you, and you need to talk with them maybe for how your family and you will do the all the things, because in your when you receive the treatment you need to be with somebody here. You cannot be alone, because when the chemotherapy finish, maybe you um, feel a little sleepy. So for return to your home, you need to go with someone.
Okay. So I need a follow-up visit, right? If it's so, when I have to go? In 4 days?
Uh, you go your home.
I know it's ambulatory, maybe, but when I have to go back to the clinic for the results in 4 days, or after or before that.
No, as told you, you need to be here at hospital these days.
Okay. Okay.
Because we need to control your nutrition for stop the damage in your stomach, because I suppose it's a cancer of stomach.
Okay. Thank you. I'm not a good patient. Okay. Mm, do I need to take precautions to avoid infections or something like that?
Absolutely, we need to take care about avoid stomach infection or wherever infection, because we need to have a strong immunologic system now. And if you
Mhm.
get an infection or to get an infection, you need to take medication, and we make a damage maybe in your stomach, because your stomach now is like a baby stomach, so need only a specific kind of food, and as a possible, we need to avoid medication, all kind of medication, by oral medication.
Okay, so what happens, yeah, if I have maybe an stomach ache? You will give me something to take?
Yes, that is why you be here in the hospital, because we injected you analgesic.
Okay, that's pretty good. Thank you. Thank you
Welcome.
so much. And now I will ask you to maybe um, think that you are treating some gynecologic patient. Okay. In that cases, how must be the explanation? Maybe for I don't know. I don't know. Whichever you want.
Okay, sometimes I think the most difficult notice or bad notice that we have to talk with the patient is about cancer. So I will take again the uterine cancer about woman. For talk with the woman, I think it's specific to know about if the woman have child firstly, if is married or that things, because I consider that when in example that a uterine cancer that is the treatment is a surgery, a total surgery for take out the uterine, and that is the option, the best option, and the cancer disappear. So um I think when the woman have child and 2 or 3 child and are married, and it's okay. Maybe it's not too hard to take this decision or do that decision. But when the patient is younger, like 22 until 30 years, is not married, doesn't have child, it's really hard because I don't know, but I want to be mother. And yes, in for a part, the hormones change a little bit because the ovarians produce some of them, and so I try to talk firstly, like that I am Christian, that the things happen with one purpose, and sometimes it's really hard to understand the reason, but we have to keep the faith all the time and trusting God. And after that, I told her that it's about the disease, but at the same time, we have a solution, a completely solution that is hard to accept it, to not be want to be mother, but they will still alive. So that is one option. And maybe the patient says, but any man want to be get married because I cannot have child. And sometimes I said, okay, the purpose of God is not to have a child, yourself child, our child, but you can adopt it, and God put in your way a good man that understand this,
Mhm.
and things like that.
Okay, so you solved her life. And that's
Yeah.
good. You give a lot of opinions and reasons for her to feel better. That's a good thing. It's part of the explanation. I think we have to give confidence and be and maybe put in their situation sometimes to give her some news, right?
Mm-hmm.
Okay, thank you very much, Salome.
Welcome.
Would you fill my questionnaire? I don't know if you can see it.
Okay, done, teacher.
Thank you. Thank you so much.
Okay,
Salome.
okay, teacher. So we see at Tuesday.
Yeah, see you on Tuesday. And I don't know when exactly I will give you tests, but just make a little reading or practice, please.
Okay, teacher.
Okay? Thank you,
Okay.
Salome.
Bye,
Take care.
teacher. Good
Goodbye.
weekend. Bye.
See you. Yeah.
Teacher, are you there? Yes. Can you? My mom is. I don't know where is she, but she is listening, and she thinks that I can pronounce stomach. Can you pronounce stomach? Stomach.
Stomach.
Stomach. You listen, mommy. Is there? Es
¿Cómo
que.
está?
Okay. Okay, teacher. So see you. Bye,
See
teacher.
you, Salome. Bye. Thank you. Bye. Hey, Carlita, how are you? Good afternoon. Hello?
Hi, teacher.
Oh, hi,
Yeah.
Carlita.
Oh my God. Sorry, my computer is slow, so I was starting very fast, but it takes a while.
Don't worry. How are you?
I'm fine here in Cochabamba. It's very rainy. It
Yeah.
rained from this morning and it didn't stop till now. So yeah, it's a very sad mood right now.
Yeah, I think here is hot. I don't know why. This morning it was cloudy and raining a little bit, but now it's sunny. So,
Mm, oh,
oh
it's better like that.
yeah, it's so crazy this weather. Okay,
Yeah.
so let's talk about yesterday's unit. Maybe you can choose a condition and make an explanation as you were explaining to a patient.
Of a condition?
Yeah, whichever you want.
Okay. It doesn't matter the type.
It doesn't.
Okay. Let's say like everything we do. Oh, okay. I
Or
don't have
I can give
condition
you
right now.
some, yeah, if you want.
Like the physical examination, everything.
You can make like yesterday, maybe you already have the diagnosis,
Ah,
so then
okay.
you can give the prognostic and that kind of explanation, okay? The last part.
Okay. Let's say about a COVID patient, positive COVID patient. What we will do a very specific treatment. You have, let's say, a moderate degree COVID. So we have to uh, intern. Oh, I always forget. It's like income you or have
Income. Okay, you're a patient income, an income patient. I'm sorry.
income. And how I say the verb of like internar.
It's like that, an income
Okay.
patient.
Okay, you will be an income patient because you have the PCR results that gave a positive result. So we have to take care of you. You are not as bad, but you will need oxygen treatment permanently. So it's a slow degree, 5 liters per hour of oxygen, so it's not as bad as or as hard for you. And it's something, if you have some fever, we will treat you with some uh, um, how do I say it? We will treat you with some antipyretics, maybe.
Yeah.
Yeah, okay. So we will give you, you have to tell us if you have some uncomfortableness. You have to stay quiet and no quiet. You just have to relax and being calm that we will treat you as well as we can, and you are in good hands. The prognosis is that you 89% of people will heal, so you don't have to worry as much. So you have to keep it up and being optimistic and follow all the instructions. Some physiotherapists will help you and will give you some treatments 2 times a day, in the morning and before you go to sleep. And it's better if you cough and expute the phlegms,
Mhm.
and you don't have to stay sit down. You have to walk a lot to move all that mucus on your lungs, and you will get better. And yeah, that's pretty much it.
Okay. I just have three things. You can use the word hospitalized
Oh,
to
yes.
yes, one. And
Okay.
antipyretic, it's okay.
Okay.
And the last thing you said, I forgot. I had something little there. Okay. Till then, I will ask you some questions as if I were your patient. Okay. Maybe
Okay.
you said to me, okay, so do you have any questions? And I will say, the treatment will work for me.
Well, as I say, the 89% of people will heal and recover completely. So if you treat yourself well, if you eat well, and if you follow all the instructions, you will be probably at home in 2 weeks. Yeah.
How will affect my home and work?
Well, you, as an income patient, you won't go to work. And after the hospitalization, you have to go 14 days at home to be in a quarantine. So you probably have to ask a permission there.
Okay, so I don't have the chance to be with my family either.
No, no, and you cannot share your things. You have to have your plates, cup and plates. I
Yeah,
how is
dishes.
it? Ah, exactly. Your dishes apart and wash. If you can wash it with a little bit of, I don't know how to say lavandina, a little drop of the lavandina,
Okay.
and to just care of your dishes.
Hypochlorite. Uh,
Hypochlorite. Yeah, I think.
yeah, it could be, or maybe let me check. The word I was looking for, it was expectorate the flames.
Bakery. Yeah, so sorry.
Don't
Yeah.
worry. Oh, bleach. It's lavandina.
Oh. I thought bleach was the thing that make the hair whiter.
Yeah, it's
Mm.
like people use on the
Oxygenat.
hairstyle. In Spanish, I forget where.
Yeah, I heard that word like a girl saying, "I will bleach my hair," and she makes that
Yeah, they
yellowish.
use the same product, almost the same product, but I don't know what is the name. I just forgot. It
Okay.
comes in little bit bottles.
Yeah.
You can change the color of your hair.
Yeah. I will search it later.
Okay.
Okay. Maybe it sounds the same.
I forgot. I will tell you later if I remember, okay?
Okay.
So, um, what else? What would be the well, you said to me that I can recover, but what would be the main prognosis for my case?
The main prognosis?
Yeah,
Okay. In your case, I can say you will get better because your lungs aren't um, so I don't know, say,
damaged
mm, full covered
or
of mucus.
affected. Oh, okay.
Yes, affected. It's not as much affected as other people.
Mhm.
So we think if you follow all the physiotherapies, the treatments, you will get better as soon as possible. So you have to keep it very. You have to be very responsible. Yeah.
I'm responsible. Okay. And what symptoms should I watch for?
Well, you will have fever, and that's very expected. So, and we have to treat it as fast as it occurs. So you have to tell the nurse in charge uh, to give you an antipyretic. And maybe if you have too much pain, it's because the inflammation. So we can give you some dexamethasone that it works very well too. And as far as that, you are fine with that. But if you get worse, we can give you more things.
Okay. And how safe and accurate are the tests?
Well, it's we call gold standard to the test that is the best option to discover an illness. So this PCR is the best option for you to discover COVID, and there's no other way we can find out better. So you can be sure that it's COVID.
Okay. So do I need a follow-up visit?
Yes,
Uh, when?
we prefer visit you at home because we don't want you to come here because it's a danger for you because you will be comprometido. How I say like
Accomplished.
inmunocomprometido? Oh, okay. You will be
Ah,
uh, immunocompish, maybe. Let me see.
yeah, immunocompromised.
Oh, okay, yes. You will be immunocompromised because you just had the illness. So we prepare to go at your home and visit you there to see if everything is going fine.
Okay.
Well,
And
that's the idyllic part, right? But it doesn't
okay,
happen sometimes.
okay, thank you. And how is the disease or the condition treated? What else I have to take?
Well, at home, you at home or in a hospital? Because in hospital it will be
No, no, I don't think so. You will take care of me, right? And
yes.
maybe at home.
Okay, at home you will be in quarantine. It's better if you have your own room with your own bathroom and you clean it up at least twice a week with bleach. And you cannot share your things or your clothes or let your pets in. So you have to have your things inside And if someone wants to help you to wash your things, they have to be very careful and take all without, I don't know how to say, estirar.
The blankets
Yes, they
or
don't have
sacudir?
to, exactly. So they don't have to start.
Shake the blankets.
Exactly. They don't have to shake your blankets or your clothes in without washing machine and hot water and a detergent. It will get the COVID disappear. So it's not as hard as it seems. So you have to have something to entertain yourself, right? Because you can get very
Read the book,
infected.
woman.
You can have a lot of books, or you can work. If you are feeling right, you can watch TV. It's better if you try to do a little bit of exercise to move all that mucus that is left in your lungs, and have a really good dental and oral care, because it can prevent some cases of pneumonia. And if, well, that's pretty much what you will have to do at home. So it's easy and you can do it, and we expect you to get better there.
Okay. And the baking soda works in these cases?
It will work if you have a no, well, if you weren't sick and you were on the streets, but it's very low probability that you will get infected by oral way, because we the most of the times we inspire the COVID, so we don't eat it. So maybe in the case that you ate some food that is contaminated, it will work probably, but it's not as sure because we don't have any experimental cases. But some people say that it works. So and I
Maybe,
see some studies that they say that it works to oral contamination, but as
I don't
everything,
know.
we have to see it. Yes, because if they get it in bad two ways, so we cannot discover that as easy as other illnesses. We have to do a lot of experiments yet, but it
So,
won't damage you if you want to do it. That's the that's
okay.
the
So a
easy.
mouthwash, it would be okay.
Yeah,
That
chlorhexidine. Yeah, to prevent another kind of pneumonias that can um, come with the COVID. Yes, it's better if you do it.
okay. Okay, doctor. Thank you very much.
Thank you, teacher.
Thank you, Carlita. Share with you my questionnaire, please. I
Okay,
will ask you to fill this.
it's done.
Fill it. Thank you.
Thank you, teacher.
Thank you, Carlita. Thank you for coming after. Before, I'm sorry.
No, it's no problem.
Liz couldn't come, so okay. Thank you. See you next week then.
Okay, teacher. See you next week. Have a nice weekend. Good
Have a
night.
good weekend. Bye. Bye.
Thank you. Goodbye.